Good afternoon. I would like to go over the parts of your stethoscope. First, we're going to start with the earpieces. In your box, you should have had a couple earpieces to choose from. You want to make sure that you pick the one that best fits inside your ear. Your stethoscope earpieces should be facing forward before you apply them. On the distal end of our stethoscope, you're going to find that there are two heads. The first side is a large diameter circle with a flat surface. This is known as the diaphragm of your stethoscope, and it best picks up high-pitched sounds. We will predominantly use it during the pulmonary examination, but it is used in the cardiac exam as well. On the other side of the stethoscope, you'll see a small diameter circle. It has a concave or hollowed surface. This is referred to as the bell of the stethoscope, and it best picks up low-pitched sounds. Now, interesting to note that when you received your stethoscope and you pulled it out of the box, this is what you probably found. So again, I still have the earpieces that I want to make sure fit my ears correctly, and then I'm going to look to the distal end. On one side, we have a large diameter circle with a flat surface. This is the adult diaphragm. And then when I rotate the head, I find a small diameter circle, but here I also have a flat surface. This is the pediatric diaphragm. So you'll need this piece when you go on your pediatric rotation, but for this week's lab and for when you're treating adults, you're going to want to switch this out to the bell. You can find the piece and the instructions in the box. When we get back to the bell and the diaphragm, we're going to use both sides of the stethoscope to do the cardiac exam in all four areas. Thank you for your time today. I would like to review with you today the surface anatomy and the location that we're going to auscultate for the cardiac exam. In the beginning, you may need to palpate to identify your landmarks, but with more practice, you'll be able to easily identify them. Beginning at the top, we have our jugular notch, the manubrium, and remember when you feel that change in direction, you're at the sternal angle or angle of Louis, and I can find my second rib. I'm going to want to begin in the second intercostal space. On the right side of the body, you can find that where we best hear the aortic valve. We best appreciate the pulmonary valve and the second intercostal space on the left side of the body. Then the fourth intercostal space to appreciate the sounds of the tricuspid valve. And the fifth intercostal space, mid-clavicular line. We are over the apex of the heart, and we best appreciate sounds produced by the mitral valve. So remember, we're not directly over the valves, but it's where we best hear them. We're going to begin by using both sides of the stethoscope. First, I would like you to use the diaphragm of the stethoscope. This is the large flat circle. We're going to begin by placing it over the apex of the heart, and you're listening for the lub-dub. And this is where I will best hear an S3 if it is present, or an S4. Next, I'm going to move up to my fourth intercostal space to appreciate my tricuspid valve. Then the second intercostal space on the left side to hear the pulmonary valve, and the second intercostal space on the right side to best hear the aortic valve. Now I'm going to switch sides of my stethoscope by turning the head. I'm going to want to listen using the bell, which is the hollowed or concave side. This better picks up low-pitched sounds, and I'm going to repeat in the same locations. Do you notice that this is creating a reverse Z shape? You can either start from the top or the bottom to do a regular Z or reverse Z. You just want to be consistent. I would like to talk to you today about cardiac auscultation. When you listen for heart sounds, what do you hear? We should hear lub-dub, lub-dub. And if you notice, my lub and my dub occur close together, then there's a little bit of a pause, and then I hear another lub-dub cycle. What I did not hear is equal spacing. Lub-dub, lub-dub, right? So the first sound that we hear is known as the S1 sound. That's the lub. And then I have an S2 sound. That's my dub. Then I have a little bit of a pause, and we get another cycle. Which phase of the cardiac cycle is longer, systole or diastole? We spend more time in diastole, so the space in between my S1 and S2 sounds represent systole, and the space between the S2 and the next S1 represent diastole. What's happening during diastole? During diastole, we know that we have ventricular filling. So my mitral valve and my tricuspid valve are both open, so blood can pass from the atria to the ventricles. And we also have perfusion of the coronary arteries. If my mitral valve and tricuspid valve are open, then which two valves are closed? So we know that the aortic valve, which I'm going to abbreviate AO here, and the pulmonary valves close at the beginning of diastole, and they are making that S2 or the dub sound. The S1 sound is made by closure of the AV or atrioventricular valves, which you guys know as the tricuspid valve and the mitral valve. I'm going to abbreviate that. So our AV valves close to make the S1 sound. Lub-dub, lub-dub, lub-dub. There are two other possible sounds that we may pick up on. So the first one I want to talk about occurs in early diastole, and this is known as the S3 sound. It sounds like another dub. If you hear an S3, you're going to hear lub-dub-dub, 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 lub-dub-dub. So it occurs early in diastole. After our AV valves close, we get turbulence of blood entering a high volume or high pressure area. It can occur in our patients who have heart failure. So imagine in the preceding round of systole, when the blood was ejected, if we have a decreased cardiac output or a decreased ejection fraction, I have more blood left over in the ventricle at the beginning of the next phase of diastole. So as that blood falls from the atria down into the ventricle, it makes a noise, and we can pick up on this. So this sound can be heard in children or young adults because of the thin or smaller chest wall, but it's otherwise considered abnormal in adults, and it's consistent with heart failure. Another sound that you may hear is called an S4. The S4 occurs late in diastole. It occurs around the time of that atrial kick, and it's the result of a more stiff or rigid left ventricle. So imagine if a patient's had chronic hypertension for a long time, maybe they have cardiomyopathy or coarctation of the aorta, and it's stiff and rigid. So when my SA node fires and the wave of depolarization moves down the atria to top off the tank, you have a very full ventricle, and then you have a rigid wall. And so that creates another sound. This sound we're going to hear before the next lub. So people oftentimes describe it as ba-dun-dun, ba-dun-dun, ba-dun-dun. So when you first start learning auscultation at the 4 sites, we're going to want to listen first just for, do we hear lub-dub, lub-dub, lub-dub? And then do we hear any other sounds? Thank you for your time today.